In the lateral view and walk, Shelby is not tracking up evenly in the protraction and retraction phases of the walk on both left and right sides. He lands laterally medially with his front feet. From the cranial view in walk, no head nod is evident. He has equal weight bearing of the forelimbs in walk and trot. Some slight medial circumduction of both forelimbs is seen. Shelby portrays a good barrel swing and the head is held in nice position throughout. In the caudal view in walk, he is on 2 tracks. There is a symmetrical rise and fall of the pelvis with no pelvic hike. Equal weight bearing on the hind limbs in walk and trot is present. He shows medially circumduction in both hind limbs and has an outward rotation of both the stifle joints. There is atrophied muscle on the right hind end present, especially the bicep femoris and hamstring muscle group. From the lateral view in trot, limited forelimb protraction is seen. However, there is equal flexion and extension in his carpal joints and hocks. He is not tracking up evenly on the left side compared to the right side. There is atrophied apaxial musculature and reduced movement in the back. Less protraction in the left hind than the right hind can be seen. From the cranial view in trot, there is no abnormal hoof placement. The caudal view in trot shows that there is not a symmetrical rise and fall of the pelvis, as a slight pelvic hike on the right side is present. His medial circumduction in the limbs is even more exaggerated in the trot. Shelby is still on 2 tracks, and hyperflexion in his fetlocks and increased flexion in his hocks is present. For Shelby's turn on a small circle, he is really good at crossing over on both reins. He also has good hock flexion. Shelby backs up with diagonal pairs.